from your staff the items that were sent
Okay, that's a
for the
wellness
promotion
warrior.
of health and well-being.
Health and wellness, wellness warrior T-shirt.
Thank you very much.
Okay, Mr. Speaker, thank you for this opportunity to address us on this significant issue of the health sector and concerns that might have been raised by the opposition benches. But first of all, allow me to congratulate the Minister of Finance for a well-presented budget, well-crafted, and at the same time, allow me to congratulate his hard-working team.
Yes.
I know that many a night I was summoned by his staff to go to that building in Upper High Street, to help them craft the budget or liquidate queries they might have had while they try to create a document that would have reflected accountability and continuity. Because, Mr. Speaker, this budget, and a budget is a costed plan, comes in the wake of last year's budget, which did certain things. For example, laying the foundation for us to bring around radical change or continuation of changes already started in the health sector. In other words, we're thanking the Minister of Finance for a budget which is well dovetailed or synchronized with our previous efforts. I do note in the social sector that the Ministry of Education has now gotten a little edge over us. In the past years, the Ministry of Education and the Ministry of Health were running neck and neck. So I congratulate to the Minister of Finance for recognizing the good role that another social sector is playing. Because I'm not unhappy or jealous. I'm even happy that the education sector is so endowed. Why? Because health is not only run by the Ministry of Health. We have been benefiting remarkably, Mr. Speaker and Madam Minister, from the input of a better and better cadre out of the education sector into our training programs. So I'm quite happy that although we are not significantly increased, we are adequately increased from the 17-point-something billion that we had to just in the early 20s. That will allow us some wiggle room to address certain new issues and new challenges, while at the same time looking on gleefully as our sister ministry, the Ministry of Education, continues to produce those cadres that we need for our training programs. So the point I'm making here is that this is a budget. It's a plan. It must not be looked at in isolation. Similarly, for example, I'd like to, before I get into the health sector directly, to look at other things which we should not look at in isolation. For example, our pensioners will be better able to perform because they have a little tips in the additionality to their pensions.
What
But
a
at the
tips?
same time,
What are TOPS?
pursuing the theme
What a tip?
that we must not look at things in isolation. We must at the same time look at their subsidies
Okay.
in electricity. And at the same time, we must look at the monies that their grandchildren would be getting to go to those better run schools by the Minister of Education. In other words, Mr. Speaker, I want us to look at this budget as an integrated whole. I'd like, for example, to note that the Ministry of Health benefits also significantly from another sister government of Guyana agency body, or national agency rather, the University of Guyana. The University of Guyana over the past few years, quietly, unsung and sometimes unrecognized, has been adding significantly to the cadre of qualified healthcare workforce. I note in the budget, on page 40, in paragraph 476, that significant sums are added to help that sister body, the University of Guyana, grow and improve. I welcome this because we too in health will benefit. And later on, if time permits, you'll see how it integrates into my contribution, because I will be wanting to speak to you about the postgraduate programs that the Ministry of Health, the University of Guyana, the government of Guyana are crafting so that we can assure not only professional progression of our graduate doctors in Guyana, but at the same time, better, more specialized services from those upgraded doctors to the patients. So, Mr. Speaker, let me first of all continue to congratulate the Minister for this well-crafted document and now turn to some things more specific to health. The Ministry of Health relies on the input of several other partners. I think it was my colleague, Mr. Hamilton, who referred to the term the social determinants of health. The Health Ministry, for example, will depend on the integration and the support of the Ministry of Local Government, the Ministry of Amerindian Affairs, and I mentioned the Ministry of Education. For example, there is a misguided impression that suicide is the purview, is the remit of the Ministry of Health. Suicide is a very complex issue. The Ministry of Health is happy to play its part, and I should have said unhappy to play its part in this event, because usually we come in contact with the suicide victim or attempted victim at the end of a chain of events. So that's the theme I'm pursuing, that we need to look at health more in a more complex manner. That is why, and I'm picking out this sub-theme on suicide so as to illustrate this point, the integration of the budget and how it helps many other sectors help the health sector. We see depression, for example, as one of the underlying causes, but there are other social factors that lead to suicide. As a result, the Ministry of Health has recognized in the past few years that mental health needs to come more closer to the front burner and get on the front burner. As, for example, is another area of health we have some concerns of, rehabilitation medicine or rehabilitative medicine. So very recently, and this I'd like the media and the audiences in the audience in the gallery to note, this was very much publicized. The Ministry of Health conducted early in this year what it has said will be a continuing educational campaign whereby some 150 operatives, not only from the Ministry of Health, Mr. Speaker, but from the prison service, from the police service, from the municipality, and so on and so forth, from the regional government, from the private sector, from the from the Women's Affairs Bureau and other such things. What you call this one? The Women and Gender and Equality Commission and other such bodies. A session for those people to deal with the wider society on depression. Because the Ministry of Health is convinced that this is a multitask, a multidiscipline approach and an effort needed. So here again I'm bringing out to the goody gentleman, Dr. Norton, and I'm certain he knows better, but he was making some political points, pinching at the ministry. Suicide is not only the business of the Ministry of Health. It's all of our business. And your Ministry of Health is on the move. Only recently, I told you, 150 people, and it was advertised. People are invited, many agencies took part. And the nursing school, for example, demanded that we make it not only a module of higher education, but that we integrate it more often or more frequently in as a module of their education. So things are happening. What surprises me, and this is where probably I reflect on what Dr. Prasad said, what's wrong with you people? Don't you see what your ministry is doing? It's there, it's visible. 150 people trained. So those are some of the initiatives we've taken. However, we do not do our business in the media. Probably we need to look at that, how we blow our own trumpet. So I would like to recognize the concerns of my goodly colleague across the way about suicide, but ask him to join in the effort too. For example, when such training sessions do come around, there are organizations he might belong to that can take advantage of it. That particular training, and I don't want to spend more time on this, was done by a Guyanese, overseas-based Guyanese, who is a trained nurse, and who is at the same time a trained mental health nurse, and has many other things behind his name, many other letters. So we are seeking the right persons to come and do the training. A smaller session was also held at the New Amsterdam Hospital for some of the staff and other persons there. So those are some of the things we're doing to address the issues and to assure the audience here, the House, and to assure the wider public that we have identified the right issues. I'm happy that Dr. Norton is in an advisory mode today. He's being very poetic too, but I'll advise him that it's not to be poetic, we need to be practical and realistic. and look at the wider canvas against which we're delivering health in Guyana. For example, we speak about delivery of health services at the primary health care level. This country has made bounds, and I do not like to go back 5, 10 years, much less 20 or 25 years. But let me do this. Let's look at the audience. Some of you might not know that. At one stage in this country, the only ambulance that was functioning was a little rackety one that the St. John's Ambulance Brigade had. Why are you laughing, mister? Why are you laughing like that? It's serious. 20 years ago, I think persons like Madam Teixeira might recall that. The only working ambulance in this country was the St. John's Ambulance, a little white square vehicle. What a shame that was 20, 30 years ago. Now, what's happening now? What's happening now? The change is there. The change is there. Now, your Minister of Finance has allocated this year again multi-million dollars to strengthen the national fleet of ambulances. What is laughable? What's wrong with you people? Last year there were seven ambulances, plus 7 ambulances. And what I want you to know, Mr. Speaker, you will see around the corridors young men and women dressed in black uniform. Those are not ordinary doctors. They have been given further training. And that is what you have to look at. Creating an ambulance authority, and I won't stay long on this point, is not simply buying the ambulances. You have to set up the infrastructure. You have to set up the training. I want to congratulate those young people who have several weekends, several evenings, stayed back at the training courses, which incidentally, Mr. Speaker, has been piloted, has been guided, has been encouraged and nurtured by international centers of excellence. In other words, it's not, I hear a voice in the wilderness shouting Vanderbilt. These guys actually know something. They actually do read something. Now, so these persons, and you see somebody's complaining about the salary, but look at the young people. Gleefully coming here to do the job. Loving it. Loving it. Why? Because, as I will tell you, we don't only have salaried incentives, but you have non-salaried incentives. Training, such as giving you a mark in life, such as making you an emergency medicine specialist. That is what we've been doing. And I'd like to tell you, and I'm coming only from the humble ambulance, and I made certain that there are 2 ambulances there. Because at a certain time in this country, you would have got to push the St. John's Ambulance Brigade ambulance to get it here. Now you have 2 good ambulances outside, but I want you to look at the team. The team, the crew. Those are good people who are going places. Those are good people who are going places. The Ministry of Health is a learning organization. And by definition, a learning organization trains, retrains, continues to train, and realigns. To do this, the Ministry of Health cannot do it alone. So we have been able to extend our hands for help to what we call centers of excellence. My goodly colleague across the way, Mr. Moses Nagamutu, mentioned one, but there's so many. Recently, we've been able to construct relations with other centers of excellence. For example, the Libyan Institute of Calgary University. And that has been going on quietly for the past 2 years, whereby yes, so we are speaking about the non-salaried incentives besides the pay. We're giving them training and they're staying. As a matter of fact, we have persons who want to know when the next tranche of training is coming. But I was distracted a little bit. We're crafting our relationships with centers of excellence, so 2 things will happen. Our graduate pool of doctors, and congratulate the administration, and they don't like this terminology, the Jagdio scholars that is getting in a tizzy, because he had trained, he crafted training 500 of them. And they are now going to become the specialists under the programs of the PPPC administration utilizing the strength and power of some of the centers of excellence I taught you about. So what we're doing, we're creating the future generation of specialists in Guyana. Currently, we have almost 300 just came back, and they're moving on, not only to be specialists in emergency medicine, but in pediatrics. We've had a recent batch which graduated, in general surgery, in orthopedics. More interestingly, Mr. Speaker, we have made a certain good move, supported by our partners overseas. Some of the surgeries that we were doing overseas only at the beginning of this year, for example, almost totally pro bono, the Ministry of Health was able to send overseas 10 little babies, some of them not so young, 11 years old, with serious cardiac issues. That's right. And they were treated and are back home. Shortly, because of our expanding reach and cooperation with those centers of excellence. Because right now, or a few days ago, a team came to help us further. We, in the near future, hopefully shortly after the mid-year mark, will be able to do those surgeries here. No expense, no social dislocation, and what else? Our youngsters will be getting to rub shoulder to shoulder with those top-level specialists and get exposed. That is the way to go. A progressive organization. I'm hearing another voice in the wilderness. Let's go back not to 300, but 500. From 500. Why? No, they're attacking my doctors, man. Okay. Now, I want to say that in this country,
you got a cure for bad lighting?
Approximately. That was Mr. Williams interrupting it.
I see.
Okay. So, Mr. Speaker, that's one aspect I'm trying to address. I'm trying to say that we have been able to invest heavily over the past period of this administration, and we in the past too, into human resource development and management. In other words, not only did we think to create the cadre of graduate doctor, but even before they graduated, we were crafting postgraduate programs. Congratulate us for that. At the same time, that's why I spoke to the University of Guyana. It's not health, but yet it's health. It's an integrated approach to managing health. They are going to make me or help me produce those persons. Now, Mr. Speaker, Guyana is a large country. We are as large as the United Kingdom, but we have a population which is probably could barely fit into the street in London. And we scattered all around the country. But this administration is forced to deliver quality services with a small population base all around. What have we been doing? What have we been doing? We have been indulging, Mr. Speaker, and this budget supports it further, as you would see from the speeches, the relevant paragraphs of the minister's speech, and we'll discuss this further next week, line by line. More monies are being given for training. Nursing was mentioned, and certain figures were given, and I thought that I should look at that. Yes, we've increased the number of nurses that we train in. But what is not being said so noisily this year is that we also have evening classes. I remember when I introduced the evening classes, it was scoffed at, the night school. Well, what we're doing, Mr. Speaker, is not only expanding the East Street Nursing School backwards right into the alleyway, and it's now a huge building, although you see only a small facade, but we have been able to split the sessions in such a way, and we are criticized right by these benches here. What are you doing in the night? Why are you training nurses in the night? Because the night class right now getting better results than the day class. Where you live in? No. So what you're doing, and be careful with the interpretation of data. I look about in the audience, and I see people who I think can crunch figures. There are six different papers that the nurses have to write. The failure rate has been touted by the goody doctor indicates that some might have failed, not all. There was a portion, a small portion, who might have passed all. There might be a larger portion who might have passed, not all. But what they're not telling you is that the system allows 3 resits. 3 resits. And those who might have gotten 4 papers can resit again. That's the system. We can address it. Do we give them 1 resit? Do we give them 2 resits? And what I want to tell the goodly people in the gallery is that even while they're resitting...
One second, Dr. Ramsarran. I meant to bring to your attention that you seem to be spending a lot of time in the... You are to address your comments within the House and the chair. You're not speaking to any public gallery today. Thank you. Very well. Thanks.
I take your guidance. Mr. Speaker, I never meant to slight you. And anyhow, Mr. Speaker, the cameras are this way. Now, but let me get this over more for the wider public, the wider consumption. The nurses are allowed 3 resits. One of the reviews that we're doing is that should we say that this is too much? Is this one of the reasons that they do not push their best? Those are things we need to look at. Because you know what, Mr. Speaker? When we are having them resit, they still get this stipend, though small it is. And I want to address this issue of stipend and pension. The stipend is small because it's not intended to be a salary. In some cases, we provide limited spaces in our dormitories. This is to facilitate persons who might have come from the hinterland or are in difficult circumstances. So, Mr. Speaker, I want to underline to your audience, both in the gallery, both on the camera, and both behind your shoulders, that we are so compassionate, probably too much so compassionate, that we give them 3 times over. And I see some of us who are pedagogues in the audience and in the benches are somewhat apprehensive. Why do I give them 3 chances? I see the goodly headmaster, Mr. Whitaker. His brow is furrowed now. Why are you giving them so many chances? At the CXC, they would have been out. So, Mr. Speaker, we are looking at the details, and I want to caution that we should not be misled by the first brush. Everybody failed. Many failed some of the papers. A very significant minority of high flyers passed everything. And what I want to say is this: we have a private school in this country too. And when we compare the results with the students from the private schools and the public nursing school, they were equal. So what I'm saying, Mr. Speaker, we have to look at this deeper. One point that is not being brought to your attention, and which Dr. Norton must know of, is the fact that we had introduced a new curriculum, and we were discussing if, besides the other points I mentioned, if that could have been an issue. But I want you to leave with this. The St. Joseph Hospital Nursing School had similar percentages of passes and failures. That has led us to decide, or to come to the conclusion, that it might not necessarily be the students, but the process. And we've discovered certain other issues. We've already written on the very day that we got the results, fortunately for us, for the 3rd consecutive year, the regional nursing body was having its convention in Guyana. Yes. Luckily for us, for the 3rd year, we officially invited them to have a look at the curriculum, to have a look at the process. And you know why? Because it was that regional body, through one of its consultants, sponsored by PAHO, which created our new curriculum, of which we're proud. We need to see now what went wrong. I'm anxiously waiting the 2nd sit-in results to see how things went. I have some issues here. For example, you might find at the Georgian School of Nursing, functional nursing paper 1, practical examination, those two, a high level of people passing. But in between, functional nursing paper 2, a lower percentage. And then clinical nursing paper 1, a low percentage. Obviously, there is something amiss. And it is not that our kids are not bright. It is the process that we need to look at. So we're doing that. I want to assure the Speaker and members of the House, not only have we written to the chairperson of the regional nursing body, and they promised to get back to us within a few weeks, that was when we had the results, but we have intentions to do our in-house analysis, and we've done some. Are we missing absenteeism, for example, among tutors? We had a little glimmer of this from the students themselves, telling us things. We're looking at that. I believe my permanent secretary, who is a man trained in human resource and somebody who is gung-ho and disciplined, has taken certain measures. The beggar report, when the investigation would have been had, will be looked at. I do know that in the past, not necessarily addressing this issue, I had discovered in the nursing schools, we have several, where some persons had put themselves on full-time university training courses while they were paid to be tutors. We will look at this. So, again, Mr. Speaker, I'm closing on this point. Crunching the data, you have to recognize there were 6 papers, and some people passed some people failed some, and a very small number failed all. A very small number failed all. So we need not to bash them, but to find out what's the problem. Mr. Speaker, we are now very happy to note, that in the speech by the Minister of Finance, he's distinctly isolated, he distinctly brought to the front burner nursing training, and indicate that his administration, his ministry will be providing, helping us with funding to review the process. And that's what we must do, continuous review of our processes. Now, Mr. Speaker, I noted some other points that were made by speakers from across the aisle. And Ms. Lawrence made some remarks regarding the delivery of services, particularly as it regards cancer, our women and our young ladies. And some of these comments definitely, up to that point, I used to put Ms. Lawrence's contributions in the category of the late Ms. Baker. But when I heard that contribution, I was a bit disappointed yesterday. I was a bit disappointed. The impression she gave, the impression the honorable member gave, was that practically nothing is being done for female health, especially health as it regards cancers in women. This is far from the truth. This is way from the truth. The Ministry of Health, that's in the Hansard. The Ministry of Health, Mr. Speaker, has over the past few years, especially from around 2006, launched massive campaigns in fighting certain diseases. Cancer, TB, but let's come to cancer. We discovered, and there was a study done by another patriotic woman of the country here, Ms. Irvin, Yvette Irvin, did a study a few years back, and she tended to show that cervical cancer occurred more frequently in women of indigenous origin. And that prompted certain realizations. However, the Johns Hopkins University was later recruited through the person of another goodly gentleman, not a Guyanese, but he should be made an honorary Guyanese, Dr. John Villaro. He came here and helped us to set up the VIA clinics. The VIA clinics, the visual inspection using acetic acid. And it's somewhat disappointing that leaders among our women are not recognizing the value and not promoting it, not saying, yes, out there, I'll stand from my spot here in Parliament and say, ladies, go do it, instead of throwing a wet damp blanket on it. Mr. Speaker, over 60,000 people, several, let me see if I find it, Mr. Speaker. Since that program, over 30,000 women, and that would be women in the suspect age, most susceptible to cancer, over 30,000 women have been examined. And I have the list here of where that service is offered. And I want to recognize some humble women, some humble people who push this program. Medex Ramsundar, Nurse Singh, Nurse Patricia Singh, also known as Anne Rodriguez, and a few others, who I would like to note. For example, Miss Nurse Luke, PCA, Patient Care Assistant Amanda Damon, people who not only deliver services in their clinics, but fetch their equipment all around the country, quietly. They must be recognized. So, Mr. Speaker, I want to say that women, yes, that's a good point, Mr. Speaker. Probably these humble workers need to be recognized with national awards sometime. I want to thank...
On that note, could I ask that you be given a 15-minute extension, please, to
Yes,
continue?
Mr. Speaker, I rise to propose that the Honorable Minister be given 15 minutes to continue his presentation.
Thank you, Mr. Speaker, for allowing the continuation. Mr.
Thank you.
Speaker, now, women's health and female child health is on the front burner. Because if you were to check our recently, only last year late, we released our strategy, and that will be for the next few years, the next 5-year period. And certain groups have been recognized as being vulnerable. First of all, the Ministry of Health has recognized, as the international community has, that there are 4 categories of chronic diseases which are threatening mankind due to change in demographics, change in eating habits, and so on and so forth. That is hypertension, which can lead to cardiac conditions and heart attack and so on, diabetes, which lead to certain things, cancers, and pulmonary conditions. Let's just invite you, Mr. Speaker, you've gotten your copy, I hope. Well, you'll get my copy, Mr. Speaker, and let the members of the Assembly probably collect their copies, e-form, and see what the ministry is doing to address these chronic diseases. Because if you check the statistics, our young, able-bodied workforce suffers from these. Here a young man, 42 years, collapse. He could have been saved if certain things were done and if he did certain things. So, Mr. Speaker, let's look at one category, the cancers. This Ministry of Health, over the past few years, have been putting that one category of chronic diseases on the front burner, especially cervical cancer, breast cancer. And let me tell you this, Mr. Speaker, I see I've got your attention. Prostate cancer is the #1 cancer killer in Guyana. But because for
Trying to scare me
everybody
or something?
and everybody. Now, what I mean, Mr. Speaker, is this. Because cervical cancer and breast cancer is more spoken of, we miss that vulnerable category. We men need to start being protected and taken care too. Okay, so, Mr. Speaker, the ministry 2 years ago introduced the HPV vaccine. This was a revolutionary and forward-looking move. It was added to 15 or 16 other vaccines that are being given by your Ministry of Health. Do you know what a vaccination program means? It means you're preventing childhood diseases, vaccine-preventable childhood diseases. Every mom here should want to sing praises to the Ministry of Health. Even on those benches, I know they want to do so, but I'm not Dr. Westford, so I can't lead the choir. She did a good job yesterday, right? But let me tell you, with the vaccine program, onward, upward, will we ever go? Onward, upward, will we ever go? Guyana has as much as 98% coverage. Larger countries, more powerful economies have lower levels. The HPV vaccine, Mr. Speaker, and I'd like to call this particularly to the attention of my honorable member, Ms. Lawrence, is aimed particularly at protecting our young ladies. It's given at a certain age so that it can fight cervical cancer, which would arise when they're 39 or 50 years old. Now, it has taken off in this country. The Guyanese people are enlightened, but there's a small fringe element. You're saying that some people over here?
They said that last year.
And yes, I checked the Hansard. Some members of the opposition benches were actually opposing that vaccine, opposing something to protect our young ladies. However, it did not get traction. As a matter of fact, Mr. Speaker, it has become so in demand that older women are also asking for it. But because it's in short supply, even internationally, there's now a shortage. Guyana got in first. Okay? So regardless of any sarcasm from the opposition benches, those things must be recognized as protecting our young women and our women folk. Mr. Speaker, women's health is intricately linked with reproductive health. It's also linked with the health of their young children, especially up to the age of 5. There are two indicators that the Ministry of Health is proud to speak of. And we would like you to bear with us as we look at the under 5 mortality rate in Guyana. And I'd like to report to you, and it's reflected in the budget down at the back in the relevant sections. I'd like to report to you that Guyana is not doing a bad job and that we are on the cusp of achieving that particular goal. Unfortunately, we've noticed certain trends that threaten us. And I think I should warn or forewarn the House and the nation from this level. We note that while we're able to control vaccine-preventable diseases, while we have been able to overcome the infectious diseases of childhood, diarrhea and dysentery and so on, we are losing our children to accidents, violence, and fires. So recently, in the past year or two, our figures, our stats have been skewed in our disfavor because of losses of the under 5 to accidents. For example, last year, I think 5 died in accidents and 3 died in fires. In small numbers, when you do the crunch, these things can make you look bad. So although the Ministry of Health has no control over the accidents directly, has no control over the fires directly, we still bear the brunt and bear the pain of losing these 8 kids last year. And 8 out of 191 makes a significant statistical shift. But, Mr. Speaker, if we were to work together in a multi-agency fashion, we need to address the accidents. We need to have, for example, a kid should not be walking on a road, even if it's a country road, even if it's a side road, without supervision. Issues like that. But, Mr. Speaker, as the strategy pointed out, we are providing services across the life cycle. And my goodly colleague from the Ministry of Health, Parliamentary Secretary, Mr. Joseph Hamilton, mentioned this. The elderly too are taken care of. The elderly too concern us. What we have been doing quietly, where are these doctors? They're not only in the city, we're sending them out. I'll show you how. But we've done another thing quietly. We have started to send these doctors to places where you have the indigent and the weak. For example, the Dharamshala. Every month, they have a doctor. For example, to the Eye Institute. So we are taking care of more and more populations. And of course, in other areas. Now, I hear some bubbling up, but these programs will take time to grow. Remember, we brought these doctors back within the past few years. They have to pass through a prescribed period of attachments at certain levels, and hopefully we will then grow the program. But the point I want to make is that within our limited resources, we're trying to juggle the deployment and the use of that valuable human resource. So you can go on a particular day, and you know what we're doing? We're planning it. The people with impaired vision, Mr. Speaker, come at a particular time to the Institute to collect their pension books or whatever. We piggyback on that and send our team to look at them. So we don't have to go all over looking for them. They come and we help them at the I think it's called St. Stephen's Green. There's a place there. This does not mean that they cannot, St. Philip's Green. So those are some of the things, Mr. Speaker, we're doing, and I see that in this budget, the Minister of Finance has given us more monies. He has given us this year, following our complaints that we could not do adequate outreaches because we had so many doctors, they were so enthusiastic to get out there, that he's given us $50 million to do exactly that. I want to congratulate him because it was a cakewalk. It was a cakewalk when we approached the Minister of Finance. No opposition. Because either the Minister of Health have good talkers, or, I think better, the Minister of Finance is very enlightened. He will be getting more and more healthy people back in his workforce. He will be getting less people spending less time in his hospitals. In other words, he'll be having a productive workforce. So, Mr. Speaker, I want to underline that $50 million have been given, and this will be done, or this will be used to push health literacy, to reach to those corners where sometimes it's difficult to reach. And this is another point I want to tell you, Mr. Speaker. The dynamics is changing. Many people are going places where they did not go before. The hinterland is opening up. Mr. Speaker, you have women getting into advanced stages of pregnancies in places where they would not have gone with their men before. And that presents challenges to the Ministry of Health. Therefore, I want to thank you, Mr. Minister of Finance, the Honorable Dr. Ashley Kumar Singh, for that additional $50 million to do that type of work. Now, Mr. Speaker, communicable diseases have also been addressed. Many of these things might have been for example, let's look at vector-borne diseases. The malaria program is doing well, but at the same time, due to the same dynamics I've just mentioned, there are challenges. More Guyanese are going more places in the hinterland. They are after the wealth that gold mining can generate. They sometimes are not as cautious with their health as they should be. This presents challenges for your ministry. That is why I would like to recognize what I saw recently in the newspapers only a short while back. I saw where 5 Region 8 villages get vehicles, and I see the ATVs. I know that these villages from time to time use them to help the health sector too. Mr. Speaker, it would be remiss of me if I did not touch on another thing, the attitude of my health workers. Some of the workers are angels, they do well, they treat my patients and relatives of patients well. But I would like to call your attention to a Kaichur News article on Sunday, March 2nd, 2014. High-risk patient testifies of life-saving care at the Georgetown Public Hospital Corporation. And here it is, this woman testifies, it's quite visible, she and a bouncing bundle of joy. She testifies that she went to that institution, and in one instance, I can give you it, Sunday, March 2nd, page 35, Kaichur News, March 2nd of this year. And she says, if I can place it, that she almost did not want to accept services because of the attitude of one worker. But that negative impression was almost immediately reversed, the more positive impression, because of the attitude, the positive attitude, the caring and compassionate attitude of another worker at the said institution in the same department. Those are some of the challenges we face, managing the human resource. So, Mr. Speaker, I would like to also point out to you, Mr. Speaker, I see the public buildings as well I recognized. Doctors at the ready during budget debate.
That's because you've adorned it with ambulances that it doesn't need.
Yeah, but now, Mr. Speaker, I'd like to point out to you that these young people are going places, more places now, and the Ministry of Health has put itself in a position to deliver, as I said last year, more services to more people at more time with more specialists, more specialized persons. Mr. Speaker, I'd like to point out too that there's another area we should not miss. shortages have been catching the attention of the Ministry of Health periodically. The issue of expiring drugs and the annual report of the Auditor General. What we do note, Mr. Speaker, is that my permanent secretary and his team has always been able to give explanations. And I have the impression that there was an agreement that those answers are also supposed to be published in subsequent reports. I will check to see if that is so. For example, indeed, there's too large a number of gift items coming in with short shelf lives. These sometimes are brought in by good, well-meaning organizations who are our friends, who bring in good things, but at the same time, sometimes they bring in stuff with short shelf lives. What I'd like to point out to Mr. George Norton, he made some very good queries, incisive queries. Now, many of those items which were accumulated over years are also in a similar fashion how sometimes we have discarded equipment which we find difficulty in getting off the inventory. And I'd like to come back to the Agricola fiasco. No drugs were dumped, none. Those drugs were expired and they were withdrawn from our Commoner Street property whereby our workforce could have used that as marsh camp. And I'll tell you this, it was painful for certain not of my good workers, Dr. Monica Godwin. She did this, and she wrote preemptively, and there is a letter. She wrote preemptively to the Food and Drug Department, telling them that she has these stuff, and she needed to clear the place. We at the same time, Mr. Speaker, and what's very disappointing is that I spoke to Kaitro News before they published, when we knew they were taking pictures. What we did have, Mr. Speaker, is an empty room, an empty space at the Agricola Health Center. The medications which were being correctly managed by my director. There are two rules that the Honorable Dr. Norton failed to tell you. What was she doing? She was separating expired drugs from current drugs. That's the law. Correct. She did well. And she was putting them to be stored, to be destroyed by the agency he referred to. And she notified that agency. In some cases, in many cases, Mr. Speaker, we are in a dilemma. These agencies move very slowly, and we have an accumulation. So you might very well find that we are hoping to destroy drugs in 2014 that have accumulated for 5-6 years. Small portions gathered up. But at the same time, Mr. Speaker, we will address the issue of expiring drugs.
Honourable Member, you have 5 minutes
I will, Mr. Speaker.
To conclude.
I will conclude, Mr. Speaker. Thanks for your indulgence. Mr. Speaker, the specialty hospital is now again on you're seeing more visibility. Piles are being driven, and as I told the media recently, almost 300 piles have been driven. There are another 200 or 300 on site for inspection, and in total we will need to drive some 1,300 piles. So things are happening there. Monies are being expended. The reports will show that millions, tens of millions, hundreds of millions are being expended. But Mr. Speaker, I want also to bring to your attention another article which shows that in the city, even in the city now, we're having to drive piles. Here it is. There are blatant building violations in the city. Remember last year, Mr. Speaker, when I indicated in particular to the Honorable Ms. Ferguson that you cannot see a building going up until you do the geotechnical survey. Trini, there's a gentleman called Trini, from the engineers department, who's actually demanding that even for smaller buildings, they do geotechnical surveys. The Ministry of Health was right. And last year when I told you we spent 4 to 6 million to do certain things, land preparation and geotechnical survey, that is correct. The officials at City Hall are enforcing what the Ministry of Health...
Just by way of correction, Mr. Boyce is a councillor with no engineering expertise.
No, yeah, okay, so, yeah.
Very well.
So the point is, Mr. Speaker, he's bringing to the attention a very good point, which resonates with what I say. And when you're seeing these pictures here, Mr. Speaker, I want you to know that it will take some time for you to see the hump, right? Now, Mr. Speaker, further I'd like to recognize another of our long-standing strategic partners. Even as we speak, Mr. Speaker, there's a scientific conference going on, a scientific conference including the Cuban Brigade in Guyana and the Cuban-trained Guyanese doctors. It's for the first time that the Cuban-trained Guyanese doctors are dominating in numbers. You see the plan, we're growing them, and they're now, previously, the Cubans would have been in the majority. This is now being done at the Humanayana. I want to recognize that, and I want to tell you that our young doctors have opened up the vista to present research items. The Guyanese research agenda in health is poor. This is an opening. And at the same time, I'd like to call to your attention, Mr. Speaker, that scientific conference is resonating well with the speech made by our Minister of Foreign Affairs last year when she spoke of friendship that goes back more than 40 years, when she recognized the anniversary of our relationship with Cuba. I'd like to tell it started on the Dragon. Yes. Now, Mr. Speaker, I'd like to tell you this. The scientific conference, which we must recognize, is being held in honor or dedicated to the 5 brothers who are now still detained as if they were spies on U.S. ground. I'd like to bring this to your attention, and I'd like us probably in closing to recognize again, as the Foreign Affairs Minister, Ms. Carolyn Rodriguez-Burkett, did last year, that Cuba is a strong partner, that we not only intend to recognize the anniversary, but to build on it, and at the same time to keep in mind the 5 brothers and make every effort, every suasive effort, to have their release and have them rejoin their compatriots in their homeland. Mr. Speaker, I'd like to thank you for allowing me to bring to you some of the concerns of the Ministry of Health, while recognizing the powerful foundation that the Minister of Finance has created for us over the past few years in health, and the enlightened budget that is presented in such a way that we can continue growing from strength to strength, that the Ministry of Health will be able to perform as a subsidiary function to support other ministries and the administration as it rolls out its social policy. We will keep the nation healthy while the other ministries in the country takes us forward collectively. Thank you, Mr. Speaker. But before I sit, I must encourage everyone, including my members, my colleague members on the other side, to endorse this budget. It's an enlightened budget. Thank you.